We had a general overview on the topic of eating disorders a few weeks ago with our last presentation, so we decided to cover one of them in a more comprehensive way.
Bulimia is one of those eating disorders that everyone thinks they have a general idea about until they actually know how extensive it is. It is not just eating and throwing up. Let's start by defining and understanding the general terms.
The National Eating Disorder Association defines bulimia as a serious, potentially life-threatening eating disorder characterized by a cycle of binging and compensatory behaviors such as self-induced vomiting designed to undo or compensate for the effects of binge eating. It is diagnosed when an individual exhibits a pattern of specific behaviors on a regular basis over an extended period of time.
Although binging can be used to describe an overindulgence of anything from alcohol to food to behaviors, when diagnosing bulimia, binging is recognized as a behavior that includes an individual consuming large portions of food in a short amount of time, typically less than 2 hours, in an uncontrollable manner.
When talking about bulimia, purging is defined as any behavior or set of behaviors that affected individuals use to attempt to compensate for the episodes of binge eating. It can include self-induced vomiting, laxative abuse, excessive overexercise, or excessive restriction.
Health consequences of bulimia can range from mild to deadly. Eating disorders are a serious, potentially life-threatening condition that affect every aspect of a person's health. They are not just a fad or a phase. People do not just catch an eating disorder for a period of time. They are real, complex, and devastating conditions that can have serious consequences for health, productivity, and relationships. Eating disorders can affect every organ system in the body and require professional help and treatment. The earlier a person with an eating disorder seeks treatment, the greater the likelihood of recovery.
Physical symptoms that include from bulimia are a never-ending list with frightening potential. Food restriction and/or purging by vomiting interferes with normal stomach emptying and the digestion of nutrients. This can result in abnormal bowel functioning, gastroparesis, or delayed gastric emptying, stomach pain and bloating, nausea and vomiting, blood sugar fluctuations, blocked intestines from solid masses of undigested food, bacterial infections, and constipation. Binge eating can also cause the stomach to rupture when large quantities of food are consumed. Laxative abuse can lead to dependence as the intestines may cease to function after extended use. More potential side effects from bulimia include dehydration, fainting, seizure, excessive fatigue, dry skin, irregular heartbeat, menstrual irregularities or loss of menstruation, tingling in the feet and/or hands, muscles cramps or breakdown, heart attack or stroke.
There are also neurological and emotional effects of bulimia. Depression, manic depression, and anxiety are very common amongst eating disorder sufferers. Brain functioning may slow because of malnutrition, and the synapses and motor neurons may also falter in their function as a result of low caloric intake and dehydration.
The National Eating Disorder Association has gathered some data over the course of several years to explore the prevalence of eating disorders in the United States, the United Kingdom, and Europe to help people better understand how common they are. Although past studies use more frigid definitions of eating disorders, thereby downplaying their prevalence, more recent studies emphasize their prominent existence in many different countries and groups of people. Now let's touch on some of them statistical findings.
At any given point in time, 1% of young women and 0.1% of young men will meet the diagnostic criteria for bulimia nervosa.
A 2007 study asked 9,282 English-speaking Americans about a variety of mental health conditions, including eating disorders. The results, published in Biological Psychiatry, found that 1.5% of women and 0.5% of men suffered from bulimia at some point of time in their life.
Between 1.1 and 4.6% of females, and 0.1% and 0.5% of males will develop bulimia.
Subthreshold bulimia, or people who have some of these characteristics or even all of them, but they may go for long periods of time between episodes, or they may not feel as though their behaviors cause them a significant amount of distress, occurs in 2% of 5.4% of adolescent females.
A Dutch study published in the International Journal of Eating Disorders found that new diagnoses of anorexia and bulimia remained relatively steady in the Netherlands from 1985 to 1989, and then from 1995 to 1999.
Rates of bulimia increased during the 1980s and the early 1990s, and they have since remained the same or decreased slightly.
As a whole, eating disorders and eating disorder symptoms, not just bulimia, are beginning earlier in both males and females.
Now that we've stated these facts, let's get really real.
The first time I binged and purged, I was 12 years old. There was no life-changing moment for me. I never stumbled upon a white rabbit. There was no hairy, scary monster. The villain and the victim in this comic, the protagonist and the antagonist in this novel, the superhero and the sidekick in this action-packed adventure were all one person, me. I didn't plan my demise, it just happened, slowly, but also all at once. I bounced in and out of treatment centers from the time I was 13 until 18, and the last residential facility I was in sent me home and told me that I would probably never reach recovery because I put off the impression that I just didn't care. It took me 14 years to reach the recovery that doctors told me I would never achieve, and had my bulimia not nearly taken my life, they may have been right. At 12 years old, I went to the doctor for chronic heartburn, and 14 years later, I was going under the knife. I was on the operating table after 14 years of bulimia because my entire digestive system was failing. I ended up with a condition called Barrett's esophagus, which is a condition where the lining of the esophagus changes, becoming more like the lining of the small intestine rather than the esophagus. Where my damaged esophagus met my stomach, it ceased to function, causing my stomach muscle itself to begin to die inside me. The non-functional stomach tissue also caused my small intestines to begin to follow suit with the rest of my organs and die. My abdominal wall was severed from binge eating, and although my stomach was not yet ruptured, it was well on its way. At the end of a 4-hour procedure, I was left with 7% of my stomach. It's about the size of a seeded grape. I lost 65% of my small intestines, and my esophagus had to be operated on 2 more times after the initial procedure so it could regain and maintain its necessary function. I spent over 3 months on a liquid diet. I ended up in the hospital more times and for longer periods than I care to remember. 45 weeks after my life-saving intervention, I still struggle with an eating disordered mindset. I am not cured, but I'm only as sick as my secrets, and I do my best not to keep them anymore.